go ahead. We've already done the examination. I noticed that she was starting to develop a bunion on her right foot.
Awkward strut around the room.
Awkward strut around the room, yes. And then I just noticed that she had something in her knee. Her knee wasn't properly tracking. And then I asked her, hey, do you have any knee pain? And she said, yes! Which wasn't marked on the intake paperwork, but you can't escape it. There's different steps in a gait. You have, the heel strike, and then you have the swing, and then you have the toe coming off, okay? So with you, when you're walking, you were kind of doing one of these, and then it was coming in at the end and in. This is kind of protruding more here. I mean, this is like documentation. Right. You know what I mean? Like, you're going to have a documentary of what is going on, because most people forget everything that I've told them when they leave. You won't forget because you'll have a whole video. This is sticking out more on her. This is starting to form a bunion, and a bunion forms when this toe migrates, in her case, laterally, like that. Sometimes people develop hammer toes. Hammer toes are when this toe comes up and it's under, like that. They deform. And this I finally figured out through the gait analysis is probably due towards her, because of her knee and also her pelvis. So we got to do the whole thing. I don't want this to get worse. She's in her 20s, and I don't want to, by the time she's in her 50s, to have pain here. Okay, so what you do is you wear toe separators. Okay. And you've got to think of it like this. Like, I'll show you. For the bunion, it's not up here that the problem is. It's down here. So you have to space the toe out like that. And I tell people it's very uncomfortable during the day, so do it at night when you're sleeping. We sleep 8 to 10 hours a day. Right. Do it at night. Yeah, you just hold it like that. Okay. Because during the day, you're pushing it that way. So try to stretch it like that. Okay. That's how your toe, do you see that? This is how your toe should be. Yeah. Okay, and it's starting to, this bone is sliding this way, and this one's going that way.
And it's because of my knee?
It's because when you walk, when I saw you walk, you were rolling in on that, and I saw it happen at your knee. Okay. I thought, oh, it's at her foot, but it didn't make sense that it was at your foot because this side is actually more pronated. But why does this side have the bunion? Then I realized, oh, the force was being exerted here. Yeah. I'm not sure why. I don't know why yet. Yeah. I'll figure it out in a second. I'll know in a second. You're like, I didn't know I had all these problems. Why are you telling me all this? Because, I mean, it's like when you go into the dentist and they tell you have 5 cavities and you're like, well, I don't have any pain. Right. It's just starting to form. That's my job. If I don't tell you now, I don't want you when you're older to have pain here. When it's something you can fix now. Right. Toes. Let's see if it wants to pop for me. Yep. As long as it separates, we're good. So the other one that didn't really pop was the big toe. How does this one feel? I feel weird when I do this?
A little bit, yeah.
Do you crack your own toes?
No, I don't think I've ever cracked my toes.
Well, today. That was 2. 2 joints. Very good. All right. They all move. Just, just practice that, even with this toe. All right, reach overhead and grab the table for me. There you go. Good. You're saying this pelvis pop, this hip pops, you're saying? Feels okay. It's set in there. I see what you mean, though. Okay. You can let go, yeah. Any tenderness in here? Oh. That side.
Yeah, a little bit.
Yeah, that side has it. All right, any pain when I do this?
No, it just tickles.
Sorry. All right, it's not on this side anyway. This is the side that I'm more concerned about.
I don't know why it tickles.
Oh, was it really ticklish?
Yeah, I have no idea why.
It's because tickling is the predecessor to pain. So I would have to probably push harder, and then it's painful. But I'm trying to feel, maybe I can do it lightly. Yeah, there it is. It's right here. Do you feel that?
Yeah.
There's a knot there. Sometimes it's down here Any pain there?
No.
See, that's interesting. Now watch over here on this side. Pain? Pain?
A little bit.
It's lower on here and higher. I'm just saying that it's right. Oh, I've almost got it out. It's not bad. But you need to work, like with the foam roller, you need to roll these out.
Okay.
Coming in today because she's suffering from mid-back pain. And then she's saying you feel some tension when you turn your head.
Right, tight on the left side.
To the left. And I told her that's probably because she has a right atlas, so we're going to find out right now. Come on your back.
Alrighty.
And there she is, right there. Okay.
Great.
I mean, that's clear as day. She can't look to the left. It's because her atlas is stuck to the right. So she has to work harder. 50% of your range of motion is located in the top 3 bones. Sometimes the whole spine does weird things when you lay down. Don't you like feel more pain at night? You know, sometimes you're like, why?
Yes.
Because sometimes the spine settles into weird positions that aren't as apparent when you're standing. I'm starting to drain it. Okay. The first pass is always the worst. But this side shouldn't be nearly as bad.
It's not.
Yeah, this is... I'm struggling to find anything. A tiny little bit of tension at the bottom. Oh, okay, there's that occiput. Sorry.
Yeah.
Sorry, that's that spot. I know. Ah! I got into it. We were doing okay until I hit it. It's like this piece that goes up and down. It's attaching your skull to your body. You need that. It builds up from looking down. It gets stretched doing that. So I'm trying to bring that back and kind of push on it to relax it. I'm sorry. Now go ahead and just like look.
Yeah, it's already a whole lot better. I feel like I can
turn a little bit more.
Yeah.
But now let's do the adjustment. It's going to be over soon. Here we go. Right here.
Oh my god.
Very good. How was that?
Wild. It felt so good.
All right, here we go. Other side. Oh, man. Here we go. I got to come up on this one. Sorry, the braid is a little bit in the way. I got to like push the hair out of the way. There we go. Just like that. Just like this. Here we go. Just that one on that side. There's a little bit more on that side,
yeah.
okay?
Okay.
Let's see if it'll do it for me. Come on back. Right here. Think thoughts. Right here. There it is. That was the last piece.
So cool.
You're alive. You're alive. I promise. All right, come on and sit up and try it. We're doing like a case study here. Is it any better?
It definitely is. I mean, it's still like tender a little bit, but yeah, it's a lot better.
As we mash this down, some of that muscle spasm will come out. The body still has to do its job here. And it will. It takes a couple hours, but it happens. But if I can loosen this up. Chin down for me. Okay, going a little deeper. Okay, so T1 rib, the first rib in your of your body, okay, it sits right here like a little collar, kind of almost like your necklace, let's pretend. And it goes like this, and it goes down and underneath the clavicle. And for whatever reason, probably because the heart is over here, that rib is lifted up high. So that's going to pull on all these muscles here and give you that feeling like something's pulling. So if I can squash this down, and then adjust the rib, we should get the other half of it.
Okay.
So this is the 50% of the range of motion up here. But we also got to get the other piece here. Is it less sore or more sore?
Yeah, that side just kind of tickles. I don't know.
This side was more intense?
Yeah, that side was sore.
That was my wrist. That doesn't count as a pop. Okay. I'm feeling it further down into here.
Look at that.
Leg check. Raise this leg straight up as far as you can. And good, down. And then this side as far as you can. And down. And there was the pop. So we're gonna have, is this about where you're saying you have back pain?
It's like a little bit there, and then maybe it's a little lower, like there.
There we go. You've had massages before, right?
Mm-hmm.
This is just where all of her congestion is. All on this right side. Check the left side. Ooh. There's, I don't know if you can see that, but there is some, I know you feel it.
Mm-hmm.
There's some significant scar tissue right here. Right here.
Hmm.
I'm just trying to locate it and see if it's one rib, two ribs. It's just one rib right there. I'm just pressing, flattening out these ribs one by one. You okay?
Mm-hmm.
No suffering in silence, you gotta tell me. Okay, starts to get a little bit more crazy up here.
Oh god.
Oh no! Right there! Ah!
Yeah, that doesn't feel very good.
Let's adjust it. It needs it. T2 on this side. Deep breath in. And let all the air out so I can approximate the joints. Perfect. let all the air out, If you don't let the air out, sometimes the patient goes, huh, because I'm knocking the wind out of them. Okay, anyway, deep breath in again. We're going to go all the way down and out. See if I can get a couple here. Yep, that was about 3. Good. Deep breath in. All the way up. Yeah, I don't know if that's where we're going to go. Nope. Oh, I was hoping. But as I push on it, can you tell how that's just stuck?
Mm-hmm. I mean, it's been fine so far.
Okay, all right. I kind of found the one that I need to work on. Nah. Nope. Not without completely knocking the wind out of you would I get that one to go. Because I'm just resting here.
Do you think you're going to be able to get it? Or, what causes something to be, so locked like that?
It's because of your posture.
Muscle? Okay.
It's your posture. Yes, muscle as well. Okay, think of the whole structure being stretched out, overworked, and it swells up with fluid as a protective mechanism because it's stuck in a rut. And when I mobilize it, the fluid will come out. That's why even though it doesn't pop, I still try. Mm-hmm. Because when I can move the joint, even if it's just a little bit, right? Even if I'm just kind of, getting it just some kind of motion, the fluid starts to drain. And I can eventually, Stop it. North,
So is
south.
this like where the situation's happening?
Okay, so here's your skull, here's the neck. It's jammed on the front. Let's give you an analogy here. There's a lot of pressure up here on the top part of it. So I've got to come in here and close it down to take the pressure off of the top part of the joint.
Okay.
My bodybuilders will take pictures before and afterwards because it will look like, by the time they get home, they're like, oh my God, it looks like I've lost so much weight. And they can suddenly see the cuts, in their muscles. I have pictures on my Facebook account of people's before and after. It's pretty shocking. Ugh. Ugh. Mm-hmm. Ugh. Oh, a little bit. You see what I mean? Hey, I can do one at a time. I saw the hand go up. Is that a white flag? I surrender. Sorry, we were doing so good.
It's not so much like down there as it is like right
on the
here
side.
That hurts. Yeah.
Yeah, this is common, very common. Trying to help this rib here. Oh, it's better. I'm trying to find it again. It might be gone. It's there, but it's really deep. You've got all kinds of stuff in here.
Great.
I didn't expect it. Once you understand this, it becomes very easy.
Mm-hmm.
It might take a couple visits to get it into your brain, but once you get it, you're good. There we go. Check it. Good. Okay.
Tickles.
Oh. Well, we can make it not tickle. I just don't think you'd appreciate it. Still tickles?
Nope. That hurts.
How about the back of the leg? Doing okay?
Yeah.
Okay, there's nothing really there. Just here. Oh my God, that's what I felt when you were on your back.
Yeah. Oh my God.
This is postural, though. It's all posture. It can all be corrected. I'll show you. This is just to get you going. Remember I told you in the beginning, all of this is so that you don't hurt yourself when you do those exercises. That's all this is. Mobilization, fascia mobilization, joint mobilization. Come on, there it is. You're doing good. There it is.
Oh my God.
You did it. You did it. Yep, and done. That's just about as good as it's gonna get for today. Other side. Yeah. Oh, look at this. Oh. One little spot there. See, it is not in this plane. It is in this plane of tissue. I felt a little one here. So arm up over your head like this. Perfect. Sometimes if I lightly go over the spine, it tells me the worst ones. Yeah, right there's the worst one. Here's where she has that odd piece of scar tissue where she did. If there's anything left of it, it'll come through. Looks pretty good. Bring back this arm. That's a cool ring. Oh, a little cat ring. Okay. And then head back for me. Yep, right to there. Breathe. Back, go back, head back. Bring your whole body back. That's it. Perfect. Other side. That's all I want. Sit up straight for me. Now, is this easier to sit up straight? Chin back, though.
Yes.
This here, it still needs more work, but we're getting there. Okay. Now, elbow, you're going to a little higher on yourself. Push your elbow back against mine. Good, perfect. You place it right at that last rib. And then you just simply lay on it. Knees are bent, head is back. Your problem is more like right here. Like turn your head again. It's had a little bit more time.
Yeah, it feels so much better.
Okay. Anything else catching?
Not really.
Okay.
Feels
you feel loose?
Yeah,
okay.
It feels a whole lot better than when I first got here.
It might feel a little irritated for a couple hours because the blood is rushing into irritated areas, but as that calms down, it usually subsides. Okay. We done. Wow, Hector. It's a great day to fly a kite. No, don't let it go down. Ha ha ha.